Do you know that when it comes to development in children, the process is the same, but the time frame is different from every child? Do you know that some children develop faster and some have slow development? Hello guys, welcome to my channel. Today we are going to look at developmental milestone and developmental delays in children. And so when we talk of developmental milestone, what are we talking about? When we talk of developmental milestone, we are talking of a time frame that is expected that every child will develop this specific abilities, or when a child gets to this point or this specific time in his or her life, there are certain abilities that it is expected that the normal child will gain or will be able to exhibit. Do you get it? So that is developmental milestone. And so we are going to look at developmental milestone in every age or every specific age. What is expected if the child is at 6 months? What is expected? The normal things is expected that the child at 6 months should do. The normal things is expected that a child at 9 months is supposed to have or to gain. So at 6 months, it's expected that a child who is 6 months old should have stranger anxiety. Here we are saying that when an unfamiliar person or a stranger approaches the child will show some kind of fear, a little fear, through crying or resisting to go to the person. It's expected that a child who is 6 months old will be able to roll over. Even on the bed, the child will try to roll to the other side, will try to put their hands and legs on the bed and try to roll or get up. We expected that a child of 6 months old will be able to babbling, ba 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 la la, those kind of sounds. The child will be able to make them. It's expected that when a child is 6 months old, that child should be able to bring things to the mouth. If you put anything there, the child can pick it and then take it straight to the mouth. When the child is at 9 months old, what are some of the things or developmental milestone we expect that a child of 9 months will be able to exhibit? A child who is 9 months old, it's expected that that child can sit without any support. That child can stand on his or a feet and hand. We expect that the child should be able to crawl. It's expected that a 9-month-old child should be able to say mama or dada. The child should be able to point the hands to something, should be able to play with others or by himself or his. A child who is 9 months old, we expect that the child should be able to understand no. When he is doing something, he picks something, they say no, stop it. The child should be able to understand. And when a child is 1 year old, that is 12 months old, we expect that that child should be able to walk, move, take some steps. That child should be able to respond to simple commands: sit down, go, come. Those things we expect that the child should be able to respond to them. We expect that the child who is 1 year old should be able to put things in a cup and also take it out of the cup. When you give him a bowl or a cup and there are items, they can put them in and also bring them out. A child who is 1 year old should be able to bang the door and open doors and bang things here and there. Do you get it? Now let's move to from 2 years to 5 years. When a child is within that age, we expect that the child should be able to play with friends. The child should be able to dress, in terms of not dressing properly, but if you bring a skirt or trousers close to the child should be able to raise his or her leg and then put them in the dress. Or the child should be able to bring out his or her hand so that he or she can be dressed. Expect that the child should be able to throw things. When you give the child a ball, the child can throw it. When you give the child a book, the child can point certain things in it. When you give the child a book, he or she can turn pages. The child can run. At the age of 4, a child should be able to hop on one feet. The child should be able to do imaginative or imaginary play. When you give him a scissors, he or she will be able to use it to cut a paper or something. When you give him a pen and a paper, he can draw something. At the age of 5, it's expected that when a child speaks, people should understand clearly. We should be able to know that this is what the child is speaking, not just the parents, but people who don't even know the child. Everybody who comes into contact with the child should be able to understand what the child is communicating. Have clear speech. Do you get it? These are a few things expected that a child at 6 months, 9 months, 1 year, 2 years, 3 years should be able to do. And so these are developmental milestones that we expect that a child within this specific age should be able to exhibit some of these abilities. So when the child is not exhibiting these abilities, comparing them to other children who are able to develop these abilities, then we say there is a developmental delay. And so when we talk of developmental delay, we are saying that a child who has not gained certain abilities or certain development expected of him when compared to children of the same age. A child is 6 months, cannot roll over. The child is just lying there stiff. The child cannot make some sound like ba 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 and those kind of sounds. The child cannot point his hand. The child cannot hold things. When the child is 1 year old, cannot even stand and hold something and walk. The child cannot hear when you speak, when you give commands, or when you say no, when you say come. Or if there are some children, if you say come without any sign like come, they will not know unless you do this before they will know. So it means there is something not right or something is going on something wrong is happening to their hearing. There are certain children, even when you do this, they will not know unless you say come before they will hear. Maybe the child is having problem with the vision. Do you get it? And so if you realize that your child is 5 years, cannot make clear sentences, people cannot understand him. You yourself as a parent, you cannot even make meaning of what he or she is saying. They don't make clear sounds or clear sentences, then it means there is a delay somewhere. We talk of developmental delay. Developmental delay is not disability. Developmental delay is not impairment. On the other hand, developmental delay can lead to impairment or can lead to disability. If care is not taken, if early intervention is not given, it can lead to impairment or disability. Hope you get it. And so when we talk of developmental delay, what we are saying is that, yes, we expect that every child of 6 months should behave this way. A child of 1 year old should behave this way. A child of 2 years should behave this way. The process is the same for every child, but the time frame might be different. Some children might not be speaking at the age of 1 or 2, but when they are 3 years, they will start speaking. Some children might not be crawling at the age of 9 months, but when they are 2 years, they will start crawling and they will start walking. And so this is a delay. It doesn't mean they will not walk at all, or they will not speak at all, or they will not hear at all, or they will not be able to write at all. Let's look at the causes. The causes can be genetics. When we talk of genetics, we are looking at chromosomes. Every human being is made up of 46 chromosomes. 23 from your mother, 23 from your father, to make up of the 46 to make you as a human being. So maybe instead of 23 from your mother, it's rather 22. And so your chromosomes are not complete. Anything can happen genetically which can affect developmental growth. So when your chromosomes are not complete, it's going to affect your development. Do you get it? It can also be family history. Maybe in the family they have a slow development when it comes to walking. Some families, children walk at the age of 2. It's also there. It can be environment. When you are the mother is exposed to toxic in the environment, it can affect the child in the womb. The things that the mother eats, the food you eat, the things you drink. You are pregnant and you are more of coffee, sugar, and those things. It can affect the child's behavior or mental growth. When you give birth, you can give birth to a child who is very hyperactive. Do you get it? It can also be as a result of abuse. When the mother is going through emotional abuse, physical abuse, it can affect the child in the womb. It can also be as a result of accidents. When woman is pregnant and she experiences any form of accident, either domestic accident or whatever accident, it can also affect the child in the womb. The child will be giving birth to and is not able to develop in certain way. Also, another cause can be as a result of low birth rate. Low birth rate. When you give birth and the child weighs like 1 point something, it's going to affect the child's development, the growth of the child. It can also be as a result of the age of the mother or the age of the father. If you are too old and you give birth, you can give birth to a child with Down syndrome. And at the end of the day, the growth of the child is going to be impaired or is going to be delayed. Do you get it? So you're going to look at some of the areas that can be delayed in terms of developmental delays in children. We can have developmental delays in these areas: cognitive delay, speech delay, emotional delay, social delay, motor delays, behavior delays. So we are going to take these areas one after the other and discuss them. Now, when we talk of cognitive delay, we are talking of an individual who has limitation in mental functioning. Cognitive has to do with the mind, the brain, because our whole being is controlled by our brain. For you to be able to walk, for you to be able to eat, or for you to even sense that you are hungry, for you to be able to dress, for you to be able to run, they are all controlled by our brain. And so if someone has a cognitive delay, it means that all these areas can be affected when someone is delayed cognitively or mentally. Even how to take care of themselves is difficult. They don't have that ability. This limitation can cause the child to learn slowly. And so when it comes to learning disability, the child not being able to perform very well in school in terms of reading, solving maths, and in terms of even getting along with his or her friends, difficulty in speaking, difficulty in paying attention. Children with cognitive delay also have problem with information retention. They cannot retain information. They cannot memorize. They easily forget things. You tell them something today, the next minute they can't remember. Also, when it comes to cognitive delay, studies indicate that, or studies shows that male children are more affected with cognitive delay than female children. An example is autism. Male children are affected more than female. So when you pick every female child with autism and you compare it with men are 4 times. So if you have 2 female children with autism, then we are going to have times 4 of that 2 female children. The next one we are going to look at is motor delays. When we talk of motor, we are looking at the gross motor skills of the child and then the fine motor skills of the child. These motor skills has to do with our muscles, facial muscles. We have some children, they cannot even smile. They cannot move. Their facial muscles are so stiff. Some, their limbs are very stiff. They cannot move their limbs freely. Some cannot hold things. Their fingers are very, their fingers are not well developed, so they cannot hold things. When you put anything in their hands, the thing will just drop. They cannot hold it. Some too, they have the inability to use one side of their body. Realize that one side of their body is like dead. It cannot function. It cannot do anything. Children with motor delays, they are mostly clumsy. You can see clumsiness in their life, and they easily fall. You hold them to stand, leave them, and then they will fall. Children with motor delays cannot also tie their lace, or cannot lace their shoes. They cannot wear their own dress. They cannot remove. They can't do things that has to do with the muscle, like with the hands, with the legs, sitting, walking, crawling. They can't do some of these things because their motors are delayed, or their motor skills are delayed. Delay is speech delay. Speech delay. So what is speech delay? When we talk of speech delay, we are looking at the inability of the child to use speech, to say certain things like mama, dada. A child is 3 years old and still cannot say go, come, mama, dada, cannot speak, finds it difficult to utter a word. The child's speech is being delayed. And then when it comes to speech delay, studies shows that it affects 10% of children. Speech delay. So if you pick 100 children, the possibility that 10 out of those 100 children have speech delay is there. Children with speech delay also don't understand simple words like stop, no. They don't understand instructions. And speech delay can be as a result of hearing problem. Maybe the child has hearing problem. That is why he's not developing speech as quickly as possible or according to his age. It could be that the child has intellectual disability. That is why the child's speech has also what's delayed. Like I said, our brain is what controls everything, our speech and all that. So if the cognitive, the brain has a problem, it's going to affect the development of speech also. Now let's look at social, emotional, and behavioral delay. When we talk of these three things, it's about the child has a problem with making friends. A child of 3 years old can't go close to other children and play with. He's always to himself. When he sees people, he tries to run away, hide, like he's shy. He cannot do anything in public. He's always to himself. It's always like he's scared of someone. The child is not developing socially, emotionally. The child is not developing. There are children, if you see a child who is very hyperactive, cannot sit at one place, cannot pay attention, always very hyperactive, they have that behavior disorder, even eating disorder. They don't know how to eat well. A child with anger issues, every little thing the child is getting angry and trying to destroy things here and there. It means the child has behavior problem or behavior delay, emotional delay. They don't know how to manage their emotions. They are always angry, acting anyhow. And studies show that 17% of children have these social, emotional, and behavior delays, meaning we really need to give it attention. Children with these delays, they don't know how to smile. Say something funny, they will just look at you, they will not smile. They are always moody. They are not able to express their emotions. When they are going through pains, they don't express it. When they are happy, they don't express it. They don't play with other children. They lack self-esteem. They have no self-esteem. And so if you tell them to do anything, they're like, no, I can't do it. They are always negative about themselves. There's always fear in them when you ask them to go out there and do something, because they always think that they will fail. They always misinterpret what others say. And so they're always being hurt. When you are even joking with them, they will take it at the wrong side and then act on it. Now, when you find that your child has a developmental delay in any of these areas that I mentioned, what do you do as a parent? The first thing to do is to take them to the hospital. Let the doctors diagnose them. Sometimes you might think that, oh, as for our family, we have delays in walking or delay in this. But before you conclude that it's a family history, go to the hospital, let the doctor diagnose and say that there's nothing wrong with the child. The child is okay. The child will develop at his own pace. Do you get it? But if you sit there and you say, oh, as for my family, we have that history of delay in walking, maybe that child's own is not about family history, but it's as a result of some cognitive delay or some hearing problem. That is why the child is not developing speech. And so the first thing to do is to take the child to the hospital for proper diagnosis. Apart from that, depending on the child's problem, the child can get a specialist, like a special educator, that will help the child to develop well. The child might need an occupational therapist, help the child to acquire certain skills that will help the child to live his or her life, to dress well, to know how to eat, to know how to do certain things. I'm talking of life skills or basic skills that the child needs to move around, so that he or she will not totally depend on the parents. And a physiotherapist or physical therapist will help the child, will give the child certain exercises that will help tone the child's muscles, so that the child will be able to stand, the child will be able to crawl, the child will be able to walk, will be able to take some steps. The child, based on the child's problem, maybe speech problem, will need speech and language pathologists who will help the child to acquire speech. And so when you find these things, Don't just sit down and say that, oh, let me wait, let me give myself 1 year and see what the child will do. No, quickly take the child to the hospital, because most of the disabilities in children is as a result of not giving them early intervention. Early intervention would reduce or will prevent disability in children. Do you get it? Now, apart from seeing the doctor and getting the specialist for the child, you, the parent, to try your best to encourage the child to talk. Don't make fun of the child. Stop using demeaning words on the child. Try, and when you are there, try and hold the child's hand and help the child to make steps. If the child is even able to make one step, congratulate the child. If the child is able to make one sentence or say just a word, congratulate the child. Let the child feel good about themselves. Help the child to develop positive self-esteem. Don't be talking down on the children. Most children have social problem or emotional problem because their parents neglect them. They don't care about them. The child has to deal with their emotions by themselves. You are not giving attention to the child. Give attention to the child. As a parent, learn to say sorry to your children so that they will also learn those skills. When you say sorry to them, it helps them emotionally. It helps them to calm down. Do you get it? They don't have to deal with those emotional burdens by themselves. So don't neglect your children when it comes to their emotional needs. Hope you get it. Sometimes the parents try to restrict their children because they don't want them to play with certain children or keep them in the room. No, allow the child to go out there. Allow the child to play. Allow the child to interact with his or her own environment, because through that the child will learn certain skills and also be able to develop quickly. Be interactive. Engage the child in talking. Don't say, ask for my child, he doesn't talk. When you ask him anything, he will not mind you. No. Engage the child in talking. Be more interactive. Also, change the child's environment. Maybe the environment the child finds him or herself in, there are no children there. That is why the child doesn't have any child to communicate with. That is why the child's speech is being delayed. So change the environment. Maybe when you change the environment and the child finds himself among other children, the child will start developing speech. Also, maybe in the environment is very toxic. They have problem with anger, they have problem with their emotions, so it is affecting the child. When you change the environment, you will realize that the child's emotion will be in order. And so look at the environment, certain things in the environment that is not helping the child to develop well. Take those things from the environment or change the child's environment so that the child can develop very well. No child is blockheaded. You just have to know where the child is good at and then focus on that aspect. Some children are good when it comes to math, English, science. Fine, some children are good when it comes to artwork, when it comes to doing things with their hands. And so focus on what the child is good at and praise them and encourage them to do more instead of focusing on what they cannot do. And even what they cannot do, you can encourage them to try. Thanks so much for watching. If you have not yet subscribed, consider subscribing. Like and share this video. Have a blessed day. Bye-bye.